Alzheimer's disease continues to have a devastating impact all across Texas. According to the Alzheimer's Association, more than 460,000 people are currently living with it, and over 1 million Texans are serving as unpaid caregivers. This November, voters will decide on Prop 14. That is a measure that could make Texas a national leader in Alzheimer's and dementia research. And if passed, it would direct $3 billion from state surplus funds over the next decade to create the Dementia Prevention and Research Institute of Texas, making it the largest state-funded program of its kind in the entire country. Joining us now to talk more about what this could mean for families and researchers is Melissa Sanchez. She is the Texas Senior Director of Public Policy for the Alzheimer's Association. Melissa, thank you so much for being here with us this morning.
Good morning. Thank you for having me.
All right, so first off, I want to ask, what inspired you to take on this work both personally and professionally?
Yeah, so I think my journey kind of started in law school when I was really intrigued by the way that policies are created and that legislation is created. And it was in my work in New York City doing immigration law that I really started kind of putting, the impact that policy and legislation has, and seeing the direct impact that it has on the family seen across for me. And I was intrigued by the fact that, these policies that are made in rooms and in conversations that are had miles away from these families are impacting their lives. And so I wanted to be a part of something bigger that excited me to be able to be a part of the process and make sure that the policies that are created are really have and are serving the people that they're intended to serve. And personally, I've been touched by this disease. Both of my maternal grandparents passed from Alzheimer's and a form of dementia. And then just recently, a couple of weeks ago, my maternal grandfather passed with dementia as well. So it's personal for me, but it's also personal for the more than 460,000 Texans and the 1.1 million caregivers in this state. So this is Proposition 14 is an exciting opportunity for all of us.
Melissa, so sorry for your loss, but thank you so much once again for your advocacy on this. How would the creation of the Dementia Prevention and Research Institute actually impact Alzheimer's research here in Texas?
Yeah, so it would create, as you mentioned earlier, the largest dementia research center in the state of Texas. And it would really accelerate our opportunities for innovation to find better treatments. We have treatments in the market. We're at a pivotal point in research where we do have treatments in the market, but we are looking for better treatments, more opportunities for folks to be diagnosed earlier. So looking at enhanced diagnostics and really looking at how we can reduce the cost of dementia on our families and in our state, in our healthcare system, by looking at ways to prevent dementia. And so there is new research out that shows that certain lifestyles can reduce the risk of dementia. However, we need to look further into this and kind of see what are the correlations between, smoking, high blood pressure, cholesterol, um, and see how we can really begin changing the way that we address Alzheimer's in the state of Texas from the perspective of reacting to it and start with deep preparing for what's coming down the pipeline with the aging population rapidly growing in Texas.
Okay, so we're talking about $3 billion here. That's the proposed investment. What makes this unique compared to other state-funded programs?
So it would be the first of its kind in the country, and in Texas. Texas has, always shown a commitment to Alzheimer's and dementia research, allocated about 9.3 million over the biennium. However, this, that is something that we have to go to the legislature, and that stakeholders have to go to the legislature every biennium and ask for that funding and make sure that we, continue making that progress in dementia research. And with something like DPRIT, it's a long-lasting, more sustainable structure that can really continue that momentum in progress, helping us bring, therapies to market, and then from market to patients and to physicians in their clinics.
Melissa, there's been a little bit of back and forth when it comes to this topic. Some lawmakers previously arguing that dementia research should be funded by the private sector and not public dollars. What's your response to that concern?
Yeah. So, given the enormous cost and prevalence of dementia, relying solely on the private sector for research is not enough to generate the substantial and rapid progress needed to address this health crisis. And while the private sector excels in the later stages of research, focusing on drug discoveries, clinical trials, public funding supports research into areas that may not be as profitable for private companies. Supporting funds for research into areas like prevention, diagnostics, and addressing the health disparities of dementia. So we see government funding not as a replacement for private sector efforts, but rather as a necessary complement, particularly for that foundational research and to help address the broad challenges associated with dementia.
All right, Melissa Sanchez with the Alzheimer's Association. Thank you so much for your time this morning, and sorry again for your loss.
Thank you so much.